Hi, today I'll be doing my speech on phobias. Everyone is afraid of something. Most fears are small, but in certain situations, fears can grow and develop into bigger problems. When the fear begins to dominate your life, then it becomes a phobia. Dictionary.com defines phobia as a persistent, irrational fear of a specific object, activity, or situation that leads a person to have a desire to avoid it. There are things around us in everyday life that trigger fear, but it's usually a traumatic event that is often the reason a phobia develops. Did you know that on average 4 to 5% of the U.S. population has one or more phobia in a year? Phobias can occur in people of all ages, but the average age of phobia begins is between 15 and 20 years of age. It's important to understand the symptoms and types of phobias before determining if a fear is actually something more serious. Helpguide.org breaks down the symptoms and common signs of phobias. The first, shortness of breath or smothering sensation, heart palpitations, pounding heart or accelerated heart rate, chest pain or discomfort, trembling or shaking, feeling of choking, sweating, nausea, or stomach distress. Dizziness, feeling of being detached from yourself, feeling of losing control, fear of dying. These symptoms are generally used to identify the feeling of phobia, but to identify the phobia itself, one needs to understand the three main phobias groups. Specific phobias are just as the name suggests, a fear of a specific situation or object. This can include anything from falling down to clowns. When a person is exposed to the object or situation, they experience an intense anxiety, and they will try to avoid the situation at all costs. Specific phobias are found in 1 to 10 Americans and tend to be hereditary, according to WebMD. Unfortunately for women, we are twice as likely to develop a specific phobia. In general, this phobia does not disrupt everyday life unless the object or situation occurs on a daily basis. For example, if you have a phobia, phagophobia, the fear of eating, well, then that would definitely cause some serious problems in your day-to-day life. The next type of phobia is more detrimental than the previous specific phobia. Social phobia creates deep fears of being watched or judged by others, along with being embarrassed in public. Common social phobias are the fear of giving speeches or stage fright. More uncommon fears are public restrooms or eating in restaurants. Some people will confuse social phobia with shyness, but they are not the same. Shy people don't avoid situations that might cause a panic attack. Social phobia is very similar to a panic disorder, and if the person continues to avoid the situation, it can develop into a more severe phobia known as agoraphobia, which is the third type of phobia. This is the inability to leave safe surroundings. This is the last and most extreme of the three types of phobias. People that suffer from agoraphobia can experience a panic attack at any minute, and the extreme fear of another panic attack occurring prevents them from doing anything that might trigger it. As a result, the person's comfort zone becomes smaller and smaller. The exact cause of phobias is not known, but they do seem to be related to a person having a traumatic event. There's no cure for phobias, but they are easily treated. The first step is to begin cognitive behavior therapy. This therapy involves desensitizing or exposing the person to the fear slowly. Medications are also important in controlling the anxiety of phobias. According to WebMD, more than 20% of the people go untreated in the United States for phobias. The good news is that it can be successfully treated, allowing the person to live a normal life free of anxiety. Thank you.